Welcome to Veterinary Vertex. I'm Editor-in-Chief Lisa Fortier, and I'm joined by Associate Editor Sarah Wright. Today we have Mark joining us from Chile, Pennsylvania. Mark, thank you so much for taking time out of your day to be with us here today.
No, thank you, Lisa and Sarah. It's really a pleasure to be here to talk to you today.
All right, let's dive right in. So, Mark, I found your article especially interesting because one of my cats, whenever we get our blood work done, like semi-annually, her thyroid's always like kind of on the cusp of being hyperthyroid, and we're like kind of just waiting until she goes over the edge. So, from my own knowledge, I found this very interesting. And your article discusses how hyperthyroid cats that develop azotemia following successful radioiodine treatment have shorter survival times compared to cats that remain non-azotemic. Please share with our listeners the background on this article.
So what we know is that multiple studies have shown that between 15 and 50% of hyperthyroid cats will have concurrent chronic kidney disease, or CKD. The problem with hyperthyroidism is it's more difficult to confirm or diagnose this concurrent CKD for a number of reasons. First of all, hyperthyroidism increases the blood flow from the heart, so it increases the blood flow to the kidneys, increases the GFR, or the pressure to the kidneys. That increased pressure and increased blood flow tends to lower the serum creatinine, serum BUN concentrations, and you may have a cat with CKD that we all think is very normal because when they're hyperthyroid, the numbers tend to go down and look better. In addition, hyperthyroid cats commonly lose weight, including muscle mass. Creatinine is derived from muscle creatine, so as muscle mass goes down, serum creatinine will also fall. So again, if you have a cat with CKD or chronic kidney disease, it's very common because of their muscle loss to have a lowering in their serum creatinine concentrations. So this overall, it can be very difficult to know for sure if that hyperthyroid cat has CKD or not. It's well known that hyperthyroid cats that are azotemic at diagnosis, in other words, you have a hyperthyroid cat, the T4 is high, the creatinine is also high, as we define that greater than 2, those cats are well known to have a poorer prognosis. Generally, they survive with a median survival time is less than 2 years, which is not nearly as high as those without azotemia. But one study done about a decade ago, and this was cats treated with methimazole, found that hyperthyroid cats seem to be different. Those that developed azotemia after treatment with methimazole did not have a shorter survival time than those that didn't have azotemia. And to be honest, this really didn't make any sense to me at all, because we know that euthyroid cats, not cats, your regular cat with non-hyperthyroidism that has even stage 2 to 3 azotemia or early chronic kidney disease, those cats have a shorter survival time. So it didn't make sense that hyperthyroid cats would be different just when they have hyperthyroidism. So, and this wasn't my clinical impression either. So in this study, the goal really was to study a larger number of cats. And then this study, we studied over 1,000 cats, followed from the time they were diagnosed to when they developed azotemia, between 6 to 12 months until they died. So we looked at these cats over about a 10-year period to try to make sense of this and see what we found.
Yeah, super interesting study, and I think very clinically applicable too. So what are some of the important take-home messages from this JAPMA article?
Well, my clinical impression was right, if you believe the study, because when we looked at our cats that developed CKD or developed azotemia, defined as a creatinine concentration greater than 2 at 6 to 12 months, after radioiodine treatment, their survival time was 1.5 years shorter than those cats that didn't become azotemic at that time. So survival time between the two groups was 4.3 years in the cats that didn't develop azotemia to 2.8 years in those that did. So, so this isn't to say that all cats that become azotemic after we treat them are going to die immediately, and it's a terrible thing to necessarily treat them. They should be treated in some fashion, but it's important that the owners realize this and the veterinarians realize that their survival time will be shorter. And that may influence how we manage these cats and how we treat them, which treatment we choose. Maybe we don't want to treat all these cats with radioiodine. Maybe some of them should be treated medically or dietary wise or something else.
Congratulations on a manuscript that's going to change clinical practice. Sometimes we do a lot of studies, but this one's really going to move the needle. So thank you for sharing it with us at JAVMA as well.
Well, thank you for accepting it.
You're clearly a really good clinical educator. I'm an equine orthopedic surgeon, so the last time I thought about the neuroendocrine axis was a long time ago, and even I understand what you're talking about. What sparked your interest in endocrinology?
Well, you know, I went to school. I graduated in 1976, and in veterinary school, I loved endocrinology. I liked diabetes and Cushing's in dogs, for instance. And so when I did an internship and then a residency at the Animal Medical Center in New York. And during my first year residency, I got involved in a clinical research project with a physician studying canine Cushing's disease. And that was very interesting. And for years, I was probably one of the world's top investigators for canine Cushing's disease too. But in 1979, we discovered our first hyperthyroid cat. And I was lucky because of this relationship I had working with this physician on canine Cushing's disease. I was doing endocrine rounds with physicians at the New York Hospital, Presbyterian in New York City. So when we first had this hyperthyroid cat, I went to one of the thyroidologists on rounds and I said, we have this cat with hyperthyroidism. What do you think? What should I do? How should I work it up? What we should do? And they were extremely helpful and interested. And I started a collaboration with these guys who were, I couldn't have done what we've done with hyperthyroidism without them. So once we started hyperthyroidism, my interest in Cushing's went way down and hyperthyroidism went way up. Here's a new disease no one knew nothing about. And we were seeing it. The first year we saw about 10 cats, and the next year we saw about 100 cats. And the year after that, it just kept going up and up and up. So, right now it's the most common endocrine disease in cats. And it's one of the most common diseases we see in older cats. Cats are older than 10 years of age. 1 in 10 of those cats will be hyperthyroid. So it's a very important disease.
Fantastic. What a fabulous career. It's so great to be a veterinarian and contribute and collaborate with MDs and bring that One Health approach. Yeah. Move the needle on both sides. Mark, every time we do a study, like Sarah asked you earlier about what some of the most important findings are, but we're always surprised by something. If you're really thinking about the data, what surprised you from this article?
I think the biggest thing this happens every time I write an article like this, where we're dealing with hyperthyroidism and kidney disease. And that's how some of the cats that became azotemic, I would never have thought they were. Sometimes if you have a hyperthyroid cat that's untreated and has a creatinine in the upper third of the reference interval, or has a dilute specific gravity, or has polyuria or polydipsia, PUPD, you can suspect hyperthyroidism. Some of these cats were not that old. They had none of this, and they still went on to become azotemic. So there's just not a perfect way to make the diagnosis until we treat them. It surprised me in this article, like it surprised me in the past. There's just not a good way. But that said, looking at serum creatinine, looking at BUN, looking at specific gravity, just the things that all practitioners can do and should do, that can be very, very helpful. And if you have a cat with a low specific gravity and the creatinine's approaching that 2 limit, you have to be very, very careful. And those are the cats that we want to really monitor very carefully after treatment.
I think this episode is a good reminder to clinicians just to keep an open mind. Don't take things off your list too early. Always consider the whole clinical
I
picture.
agree.
So what are the next steps for research in this topic?
Well, we're doing some studies now, or really are done, that I'm writing up, where we're looking at not just euthyroid cats, but we're looking at survival of cats with hypothyroidism, because hypothyroidism is relatively common after we treat with radioiodine. And that muddles a picture, because some of that azotemia that can develop in hypothyroid cats can be pre-renal, because hyperthyroid cats have an increased GFR and increased renal blood flow. So once we treat those hyperthyroid cats, they fall hopefully to normal. But hypothyroid cats, it continues to fall, so they can have a decreased renal blood flow and a decreased GFR. So that even makes the azotemia look worse than it really is, because of the pre-renal component. So we're looking. What we want to publish next is our findings on long-term follow-up of those cats, how those cats can also become azotemic, and how treatment with thyroid hormone replacement can help both their survival, and I think in large part because we're helping with the azotemia. Because as we supplement those hypothyroid cats with LT4, a thyroid hormone supplementation, the azotemia gets better, and it seems like the progression of the CKD slows. But that's another paper.
Well, we look forward to hopefully receiving more manuscripts from you.
That's only Jeff. That's the only place I want to go.
We're happy to hear that. So this is the next question, is something we've been asking a lot of our interviewees lately, just with the rise of different emerging technologies and such. Do you see a role for AI in this area of research?
Oh, definitely, because there may be something that I'm missing as a clinician that AI will help. Some absurd little thing in the serum chemistry profile that I'm missing that could help us do it. So I think we should look at it. I say that being someone who is I was really very against AI, and now I've been using it more, and I'm always frightened about the false facts it can spit back if you don't know what you're asking. But I've also found it to be very, very helpful for me in my work. So I'm excited to get more and more involved with AI.
Very cool. And for those of you just joining us, we're discussing how hyperthyroid cats that develop azotemia following successful radioiodine treatment have shorter survival times compared to cats that remain non-azotemic, with our guest, Mark.
Mark, what I've really enjoyed hearing you say is how curious you've been able to maintain since you got your veterinary degree and worked with the MDs. Like just like thinking, that doesn't make sense. How come that is? And what about that? How did all that combined training help you keep that curiosity and then get across the finish line with all the many, many manuscripts you've written?
I mean, I've always asked. When I was an intern, one of my staff members, and I won't mention his name because he may be embarrassed by this, but he told me once that I asked too many questions. And he told me once I better do a residency and go on, because then maybe I should go to a vet school and be an academic, because all I did was ask questions. And I've always asked questions. I've always been curious.
Did anybody call you Horseshack? Do you remember Horseshack?
No, but they probably should have. So, so for me, the clinical, I mean, I love taking care of hyperthyroid cats. I love cats, right? so that's fun for me, but it's the clinical research and learning and trying to get to the next stage to help them. Yeah, I mean, when we discovered this disease in the late 70s, we knew nothing. We knew nothing. We thought it was a rare disease that was going to go away pretty soon, and it's becoming an worldwide epidemic. So there's so much more to learn. I thought my goal in my career was to try to figure out the cause and make the disease go away, and that hasn't happened. In that regard, I failed. But I also have a lot of other people helping me that. So hopefully we will figure this out. But it's been fun. I've been doing this for 45 years, doing the clinical research on these cats, and I I, I don't know why I'm so why I find it fun, but I do. I really do. I love what I do.
What's your gut instinct as to the cause? I've been thinking about that this whole time.
I I don't think it's one thing. First of all, it's older age. When we first when the median when we first wrote our first paper, uh the in these cats, and the average age has always been about 12 years of age. The 12 years at that time was an old cat. We used to say, "Look at this cat, he's 12 years and he's hyperthyroid," and people would come in and say, that's really an old cat. Are you sure you want to treat that old cat?" Where now 12 years is not old, that's middle age.
Right.
So we did a study between 1983 and 1993 at the Animal Medical Center. The reviewer made us do this work. We did our whole hospital population. In the Animal Medical Center at that time, we saw about 100,000 pets a year. So we had a lot of cats to look at. The average age of our hospital population in that 10-year period went up by 4 years. That's how much we've advanced veterinary medicine, and that was in the '80s. That's continued to happen. That's
Right.
so we're done. So what's causing it? Part of it is, I think cats could have always had this, first of all, but they just never lived long enough. Just like you and I never used to get heart attacks because we would all die or be eaten by a lion in our community, right? Now we live longer, so we can die of some of these other diseases. That's one thing. But I don't think that's all. There's stuff in the in the '70s. That's when cat food was still starting to come out. Um, all these synthetic compounds, the plasticizers, the BPA, all these chemicals that are now so ambiguous, they weren't there before. And we've shown that some of these flame retardants that tend to accumulate in dust. We've done some studies, one of which we put a collar around the cat's neck, and we did control cats and hyperthyroid cats, and the hyperthyroid cats had significantly higher flame retardants exposure than the other cats. So I think it's a combination between their age, their genetics. Obviously, there's something in genetics because some breeds are less likely to get hyperthyroid than others, notably like the Siamese and other Oriental breeds. So age, genetics, environment with the chemicals in the environment, and probably diet. We've heard a lot about these highly processed compounds in food that are bad for us. What about cat food? The same thing is probably true there. But
Yeah.
people really haven't looked at.
Well, thank you for sharing your insight.
So, Mark, this next set of questions is going to be very important for our listeners. And the first one is dealing with the veterinarian's perspective. What is one piece of information the veterinarian should know about hyperthyroid cats that develop azotemia following successful radioiodine treatment?
Well, as I said before, if you have a hyperthyroid cat that's already azotemic, that cat has the prognosis is not very good. If we treat them, they generally live less than 2 years. So the prognosis isn't great. But as long as they're not azotemic prior to treatment, as long as that creatinine, especially if the creatinine is less than 1.5 or less than 1.8, kind of in the mid to low range, and then they do become azotemic, this unmasking of the azotemic chronic kidney disease isn't necessarily a death sentence. Some of those cats live a long time. The median survival was 2.8 years, so almost 3 years in these cats. So they can still live a long time. So why is it important to know this? It's important to know it because we want to pick it up as soon as we can so we can start to manage it. So if they have chronic kidney disease, we may want to start them on diet. There's other drugs to maybe help kidney function improve, so at least stabilize it. The important thing is that we can't predict very well, and at least right now, and that's what AI may help. But AI or not, still think there's going to be cases that we're going to be surprised that this cat became azotemic, but he did. So now we have to deal with it. So close monitoring, early identification is really important for that veterinarian to know. You can't treat with radioiodine and forget the cat saying, well, he's got to be cured now. We have to look, we want to monitor for 3 reasons. We want to monitor after radioiodine, as I tell my owners and veterinarians. We want to make sure the T4 falls to normal, the thyroid levels fall to normal. We want to make sure that the creatinine and BUN stay normal and don't start to go up, because if they start to go up, we have to address that. And then, as I alluded to earlier, we also want to make sure they're not becoming hypothyroid. So to do that, we always, for the first year after we treat, we always do a serum T4 and a serum thyroid stimulating hormone concentration, because a high TSH or thyroid stimulating hormone concentration is the best and easiest way we can identify hypothyroidism. And if those cats become hypothyroid, then we want to start treatment. And that's going to help the hypothyroidism. It's always also going to help progression of their azotemia if they have it.
Very well said. So you kind of answered this already a little bit, but what's one thing clients should know about this? If you could boil it down to like one important take home that clients should consider.
Well, first of all, remember they have to be in charge. It's kind of like of your own health or your mother's health and so forth. So this is, if their cat has been treated with radioiodine, they need to know that their veterinarian may be a very good veterinarian, but this could all slip through the cracks. So they have to remember that it's their responsibility to go in, make the appointments for monitoring, make sure the right tests are done, make sure that thyroid functions looked at, including the TSH, as we just talked about, make sure that renal function is addressed and looked at. In my practice, all the cats that we treat, we encourage the veterinarians to send me the results, and I will gladly interpret them and help them and advise them as we go along. They're not my, I consider them, they're patient, but I still would like to be involved and probably know a little bit more about this than many of them do. So I like to still be involved and help however I can.
That's very generous of you. I've super enjoyed talking to you and remembering some of these things and just learning how you've moved the needle so much throughout your career. And thank you again for sharing your information with JAVMA.
Thank you for having me.
As we wind down, we like to ask a little more of a personal question. And I'm going to guess yours is going to be about a bird, given your background. What's your favorite animal fact?
Well, it's about cats, of course.
Oh, of course. So, Isa?
So one thing that I like to tell people is the way it's not widely known that cats and the way they communicate with us, their owners, is different than the way they communicate with other cats. When cats communicate with other cats, they do it through their body language, their scent. They may have vocal cues, but they don't normally meow at other cats, where my cats have always meowed and screamed and demanded stuff. And this is something the cats have learned in their interaction with humans. So the way they address us and speak to us is learn from us. It's not normally how they would work with other cats. They don't need to. They have their own ways to do it through their scent and body language and so forth. So I again, like I just really I love working with the cats. That's been that I just that's been made my career, and finding this disease early on and spending my life doing this has been very much fun. I've really enjoyed my career.
That's awesome. Well, we complement each other well because I'm deathly afraid of mean cats, and it's one of the reasons I went into equine. So they're all yours, buddy.
Okay, well, you know something, I've had a few mean horses, and I'm glad that someone's there to take care of the horses too, and they're nice.
Yep.
Look at that. It goes both ways. Yes. Well, thank you so much, Mark. Really appreciate you being here today and just sharing your enthusiasm for this research with us.
You're welcome. Thank you very much again for having me.
And to our listeners, you can read Mark's article in JAFMA. I'm Sarah Wright with Lisa Fortier. Be on the lookout for next week's episode, and don't forget to leave us a rating and review on Apple Podcasts or whatever platform you listen to.